Common exclusions and restrictions explained. Question 1. What is the standard duration of the suicide clause in a life insurance policy? 6 months, 1 year, 2 years. It never expires. Most policies exclude coverage for suicide within the first 2 years. After 2 years, suicide is fully covered. Question 2. If an insured commits suicide within the first year of the policy, what is paid to the beneficiary? Nothing. The full death benefit. A refund of the premiums paid, sometimes with interest. Half the face amount. During the exclusion period, the insurer denies the death benefit but refunds the premiums to the beneficiary. Question 3. What is the aviation exclusion typically applied to? Commercial airline passengers, private pilots, student pilots, or military aviation. People who live near airports. Flight attendants. Standard policies usually cover fare-paying passengers on commercial flights, but exclude private or experimental aviation risks. Question 4. How does the war exclusion status clause function? It excludes death only if caused by an act of war. It excludes death while the insured is in the military, regardless of the cause of death. It only applies to civilians. It cancels the policy during wartime. The status clause excludes all deaths while serving in the military. The results clause only excludes death directly caused by an act of war. Question 5. Which health insurance exclusion applies to injuries received while committing a felony? Illegal occupation provision, intoxicants and narcotics provision, hazardous hobby exclusion, pre-existing condition exclusion. Insurers are not liable for losses incurred while the insured is committing a felony or engaged in an illegal occupation. Question 6. How do health insurance policies typically treat self-inflicted injuries? They are covered at 50%. They are strictly excluded from coverage. They are covered if unintentional. They are covered after a 2-year waiting period. Intentional, self-inflicted injuries are a standard exclusion in health and disability policies. Question 7. Under the intoxicants and narcotics provision, an insurer can deny a claim if the insured was prescribed medication by a doctor, the injury occurred while the insured was legally intoxicated or under the influence of illegal drugs, the insured drinks socially, the insured works in a pharmacy. If intoxication or illegal drug use caused the loss, the insurer can deny the health or disability claim. Question 8. Are elective cosmetic surgeries typically covered by major medical insurance? Yes, always. Only if approved by the PCP. No, they are generally excluded unless required due to an accident or congenital defect. Yes, but with a 50% copay. Purely cosmetic procedures, example elective facelifts, are excluded, but reconstructive surgery after an accident or mastectomy is usually covered. Question 9. What is a pre-existing condition? A disease you catch in the hospital. A health issue that existed prior to the policy's effective date. A genetic test result. An injury that happens at work. It is a condition for which medical advice, diagnosis, or treatment was received before the coverage began. Question 10. How does the Affordable Care Act, ACA, handle pre-existing conditions for major medical insurance? They are excluded for 12 months. They are permanently excluded. The ACA prohibits excluding or charging more for pre-existing conditions. They are only covered for children. Under the ACA, insurers cannot deny coverage or charge higher premiums for pre-existing health conditions on major medical plans. Question 11. Are workers' compensation injuries typically covered by individual health insurance? Yes. No, occupational injuries covered by workers' comp are excluded to prevent double payment. Only if the employer refuses to pay. Only after a 90-day wait. Health insurance generally contains an exclusion for injuries that are covered under workers' compensation laws. Question 12. Which type of care is specifically excluded from Medicare Part A and Part B? Inpatient hospital care, doctor visits, long-term custodial care in a nursing home, X-rays. Medicare does not pay for long-term custodial care, help with daily living activities. This requires a specific long-term care policy or Medicaid. Question 13. In life insurance, what does a hazardous occupation exclusion do? Excludes death if it occurs as a result of a specified dangerous job, example, structural iron worker. Cancels the policy if the insured gets a job. Forces the employer to pay the death benefit. Covers the insured only at work. If the insured has a highly dangerous job, the insurer may attach a rider excluding death caused by that specific occupation. Question 14. Are routine dental and vision care usually covered under standard major medical policies? Yes, they are core benefits. No, they are typically excluded and require separate standalone policies. Yes, but only for adults. Only vision is covered. Adult routine dental and vision care are generally excluded from standard health insurance and sold as separate plans. Question 15. What is the foreign travel exclusion? Excludes coverage for injuries sustained while traveling outside the U.S. Forbids the insured from leaving the state. Covers only international hospitals. Pays double for foreign accidents. Many health and life policies exclude or limit coverage when the insured is traveling or living in foreign countries, particularly unstable regions. Question 16. Which provision excludes losses caused by a riot or insurrection? Civil commotion/riot exclusion, war exclusion, illegal occupation, hazardous hobby. Injuries or deaths sustained while actively participating in a riot or insurrection are standardly excluded. Question 17. Does an accident-only policy cover medical expenses related to a heart attack? Yes. No, it strictly covers injuries resulting from an accident, excluding sickness or disease. Only if the heart attack happens at work. Yes, after a deductible. Sickness, illness, and disease are excluded from accident-only policies. Question 18. If an individual disability policy has an exclusion for a specific bad knee, what is this called? A rating, an impairment rider, a deductible, a probationary period. An impairment rider legally excludes a specific, named pre-existing condition from coverage. Question 19. What is the rationale behind excluding intentional self-inflicted injuries? It goes against the concept of an accidental and fortuitous risk. It saves the government money. It is required by the ACA to encourage reckless behavior. Insurance is designed to cover unexpected, unforeseen losses. Intentional acts violate the basic definition of an insurable risk. Question 20. Are government hospital treatments, like VA hospitals, usually covered by private health insurance? Yes, always. No, care provided in government facilities is often excluded because it is already funded by taxpayers. Only for emergency care. Yes, with a higher deductible. Many policies exclude services provided in government facilities or services for which the insured is not legally obligated to pay.